This video explains what a tongue tie is and how it can be divided if it is causing problems. We all have a band of tissue between the underside of the tongue and the floor of the mouth. If this band of skin is very tight, this is referred to as a tongue tie or ankyloglossia. With a tongue tie, the tip of the tongue may appear blunt or forked and have a heart-shaped appearance, and this is found in 3 to 10% of babies. A tongue tie can restrict the movement of a baby's tongue, making breastfeeding difficult. Signs of a tongue tie include a poor latch, frequent feeds, long and unsettled feeds, or poor weight gain. A breastfeeding mother may experience painful or damaged nipples, blocked milk ducts, or even mastitis, a painful and inflamed area of breast. An untreated tongue tie can be very painful, exhausting, or distressing for a mother trying to establish breastfeeding. Feeding difficulties can occur for many reasons, so it's important when considering treatment that advice has been sought from an experienced professional, such as a midwife or infant feeding specialist. If a tongue tie has been identified, it can be divided by one of our paediatric surgeons. The surgeon will discuss the procedure and potential risks with you, and we will obtain your written consent before the procedure goes ahead. The possible risks of the procedure include a small amount of bleeding, a rare risk of infection, or a small chance of the tongue tie reforming. Your baby may be swaddled and held in place by a nurse. The surgeon will separate the tongue tie using a sterile pair of scissors, and pressure is then applied using a piece of sterile gauze under the tongue. Usually there are only a few drops of blood. The procedure only takes a few moments, and local anaesthetic or pain relief is not usually needed in young babies. After the procedure, you will be encouraged to breastfeed or bottle feed your baby. Breastfeeding immediately after the procedure is important since it provides comfort and pain relief, reduces bleeding by applying pressure to the wound, and protects against the small risk of infection. At this point, some mothers report a significant improvement in breastfeeding. Babies can be seen to move their tongues around, push them out, and have an improved latch. For others, this improvement may take several feeds. Families can return home as soon as their baby has been checked after feeding. A follow-up appointment is not usually needed, but our team are always available for advice after the appointment if needed. The team at Paediatric Diagnostics are happy to help if you would like to arrange an appointment for your child.